Hi, everyone. This is another Healthy Read series on this is session 11. We're going to put all what we talked about the last couple of months together. And we have our guest speaker, Dr. Crystal, with us today. Welcome, Crystal. Hoping that
Hello.
yeah. And would like to take all the audience through what we've been doing and putting all this together.
Definitely. So today is a little bit of a longer. There are a fair few more slides in today's lecture, but we're going to go through it fairly concise because essentially we've gone through it over the past several weeks. But we just kind of want to touch on and highlight some important points to sort of bring home for you, and in case you might have forgotten a few things, just to sort of bring it back into the forefront of your mind. So the saying healing does not mean that the damage never existed. It means that the damage no longer controls our lives. And I think this saying can be is so important just for everyone that, to not allow an event, a trauma, whatever it has been, to be the defining moment of our lives and control how we go about doing things. Healing is moving beyond that. And so when
go ahead.
Oh no, I was just going to say, by all means, go ahead.
Yeah, no, it's just one of the things I do personally and with all the patients that I see is that it's one of the two, and you want to do the shift. Either you let the pain control your life or you control the pain. The difference is you live by the pain, what the pain is allowing you to do, versus you have the upper hand and you control that pain. And that's all the modalities that we talked about, and basic technique, breathing technique, all the stuff that we will talk about. We won't go into the details, but the idea, you have to have the upper hand in order to start healing.
Absolutely. So when it comes to inflammation in general, oftentimes people will come into the clinic and they will say they have, like in the case of patients who come to arthritis VIP, that they've got some sort of joint dysfunction or inflammation. They are, when we use the term inflammation, we're talking about it's a natural way that the body is trying to protect itself. Inflammation is actually good in many cases because it helps us to fight off infections, increase blood flow, and really bring the blood flow to places that need healing. And oftentimes, too, inflammation will generate that pain signal to kind of tell us, okay, it's time to lay off and start to rest and heal.
It's interesting that you bring that concept. The one of the analogies I bring to people, like if you have a house, and I'll come to that analogy in a sec. Is just acute inflammation is good for healing. Well, that's when the body sends all the resources trying to heal that area, because of the inflammation is a smoke signal. But when the inflammation becomes at a level, let's say 10, 15, 20%, it becomes more nagging, but enough to heal. And that's where the dilemma is: should we subside the inflammation? Should we boost the inflammation? So one of these therapies that we do, we actually want to inflame the area as a preparation before we do the PRP. And that's why we do that with the prolotherapy, which is going to send a signal for the body to send more healing troops or more supplies to this area. So when we do the PRP after, that's when we get the most of this healing process. So healing is not bad by itself. It's just depend on the level of the inflammation. The inflammation is not bad by itself. It's just depend on the level of inflammation. If you want to dial it up, that's when you get the most of the healing.
Exactly. And so inflammation, again, we can use it to our advantage, essentially, in this way of thinking of things. So we don't want to start labeling things as quote unquote good or bad, which then leads us to the next slide about stress and how stress can impact inflammation and your health and your healing in general. And so we have two types of stressors. We have the acute stress, and that can be, a dog coming and barking fairly aggressively at you, and sort of like the chronic stress. And that's where we're, at a job that we really don't like, and we are showing up all the time. And we have a lot of relationship things that are definitely compounding the way how our bodies react in those moments. And so when we are faced with either acute or chronic stress, our body will release different chemicals and hormones, and this can also have an impact on our healing. So on the next slide, in terms of acute stressors, so again, this is a scenario of a super aggressive dog comes out of nowhere, starts barking at you. What your body will do is the pupils will dilate, your heart rate will start to increase, you'll begin to sweat, you'll have fast, heavy breathing, anxiety, poor sleep. And these are all the chemicals and hormones that your body is releasing. Versus something like chronic stress, and I see this a lot in my own practice, where people will start to say, I'm gaining weight suddenly all of a sudden, I'm having difficulty sleeping, chronic headaches, diabetes, poor wound healing, cardiovascular disease. And actually the cardiovascular disease one I like a lot because, oftentimes a patient will come to me with a primary concern of they've got high cholesterol, and they'll typically say that, I was fine the year before, and then suddenly one of my year checkup, my cholesterol levels shot up. And oftentimes when I ask them, okay, well, what happened in your life in that time span? There was some type of major trauma. Either it was a move, a death, the end of a relationship, something to that effect. And it's very interesting to see how the environmental stressors, how when left unchecked, can really negatively impact somebody's health.
So just to touch base on this, this is very, very important in terms of healing. I can't emphasize how important that is. If we go back to the acute stressors, and let's say that dog was trying to attack you right now, and you have all those changes that we just Crystal mentioned, that's the body's trying to prepare itself to for that flight and flee scenario. It wants to survive. It wants to take you to safety. But imagine if you have that stamina where you could run and that dog or a bear or whatever should keep chasing you. After a while, you think about it, that's what the chronic stress becomes. Because if you continue to have that elevated cortisol level, the body, in terms of weight gain, is not going to regulate insulin, not going to regulate thyroid. You can't sleep because that dog is going to attack you, so you have to stay awake. You're going to have panic attacks because you think you're going to die. You're going to have all those headaches, cardiovascular disease, because you're putting all your body on overload. And same with diabetes, because the body is not in the right state to digest food. And it's not the time for it to heal any wounds or chronic illness or arthritis or chronic pain. So unless you deal with those chronic stressors, and we said before that the 80-20% rule, 80% of the stressors are really imaginary or perceived rather than real. And we can control that with all the modalities we talked about in the previous sessions. That's how we bring the cortisol level down. Then we start seeing some changes.
Absolutely. And actually on this slide particularly, this is something that you can do on the fly anywhere in the world, wherever you are, no matter what situation you are, to activate the vagus nerve. And now the vagus nerve is one of the larger nerves in our body, and it essentially controls how fast or how slow our heart beats, how fast or slow or how deep or shallow our breath is. And it also regulates our digestion. And so you can think of the vagus nerve as sort of the big nerve that is associated with the parasympathetic nervous system. And this is the nervous system about resting, digesting, and healing, versus the other system, which is called the sympathetic nervous system. And this is where the acute stressors happen. So fight, flight, freeze, or appease. And so gargling, singing, deep breathing, which Mark had talked about earlier on with regards to the box method of breathing. This is a beautiful way to immediately activate, strengthen that vagus nerve so that you can tap into the parasympathetic nervous system, which will allow you to rest, digest, and heal.
Yeah.
So moving on.
Yeah, so but this is to start the key to start reducing the heart rate, reducing the anxiety. Of course, this is one of the dimension that we talked about. There's the other stuff that we mentioned in previous series, including the food, the sleep that we're going to touch on, and the exercise and so forth. But it starts with the breathing. This is the least time consuming, and it can be done, as Crystal said, anytime.
Absolutely. So now going on to sleep. This is hugely important if you're dealing with any type of chronic health condition. The saying that sleep is the golden chain that ties the body and health together. Absolutely. We know that poor sleep management can lead to sleep disturbances, fatigue, and really affect recovery. We also know that disturbed sleep can actually lower your physical and cognitive functioning, and your mood, especially. I mean, I think anybody knows that if they've had a poor night of sleep, or if you've talked to, brand new parents with an infant, a lot of emotional distress is there, a lot of amplification of whatever previous pain symptoms were there. So again, we like to think of sleep stress as sort of like the low hanging fruit. If we can take care of those issues and your nutrition and hydration, honestly, the body knows what it needs to do after that. And, we focus on those, and really optimal healing can take place. So I've just talked about this slide here, and we'll move to the next slide with regards to some ways that you can ultimately really help improve your quality of sleep. So the first one is definitely lower any noise levels that may exist. So use earplugs, use a white noise machine. I happen to live near an industrial building that sometimes they can be quite loud in the middle of the night. And there was a period of time where one of their machines had broke down and it just got really loud at nighttime. And I know that for those 3 weeks, I was a grumpy, miserable human being. Not to mention what I looked like, because I physically looked like I was dragged through the awfulness. But just even physically, I just actually felt like my recovery time just was quite poor, and it was very difficult to focus on things. And finally, I think it was after like the 7 days, I just bought a pair of earplugs, and that definitely sorted things out while those machines were getting fixed. Definitely lowering the light levels. I highly recommend blackout curtains. You can purchase them anywhere, and they're really cost effective. And if in a pinch, eye masks are fabulous. You can pick one up at the dollar store, or you can get something really fancy pants at Winners or another store, but they're really easy to wear. Some of them can be even scented with lavender to kind of help calm the nervous system as well. And definitely minimizing screen time. This is so underrated. But if you can basically minimize screen time, so from your phone, from your laptop, from your TV, 30 minutes before bed, this is key, because essentially what's happening here is with any type of aggressively bright blue light or any bright light, it's sending signals through our eyes to our brain to say, hey, melatonin, now is not the time to secrete. It's time to be alert. And we need melatonin, that hormone, to help initiate sleep cycles. But also, melatonin is an amazing antioxidant, which is part of helping to heal and repair our body. So minimizing that screen time is truly important. So pick up a book, go for a bath, do your meditation, do some prayer, sit down, have a talk with your partner. But really do things to help minimize and avoid that screen time altogether, ideally 30 minutes before bed. And consistency is key. In Chinese medicine, because I practice that a lot, we really try and encourage our patients to get into bed ideally 10 p.m., but at the very least before 11 p.m. There is a saying that every hour before midnight is worth 2 hours after midnight. So if you go to bed at 11 o'clock and you wake up at 7, technically you would have had your 8 hours. But in sort of the way how our body perceives it, you actually gained a total of 9 hours of sleep and repair at that point.
So if you look at this, it's not about the know-how, it's about creating habits. Because if you put this as a checklist and you don't deviate from that routine, that's how we're going to institute those positive or good habits, and then it becomes something easy. So personally, what I do is there is a certain way I'm going to close the curtain, dim the lights, close the doors. I don't want the cat inside the door. So inside the bedroom. So I try everything possible for me to minimize that noise, create that darkness, not play with the phone, and sleep at the same time, get up at the same time, even whether it's a weekday or weekend. So over time, which is literally you're looking at 4 to 6 weeks, the body will catch up and becomes a new routine, and you don't think about it anymore. So you can move to the next step, which whatever you want to do, and whether it's the meditation, the exercise, the food. And so the idea is to create one of those blocks, each one of those blocks to become more of a habit and a routine. That's how you can so successful at it, and you can repeat the process over and over again. One other,
Absolutely.
yeah, and the other thing that's very interesting is I want you to think about it. You're not just doing this for you because you're going to do it for everyone in your family. Because if you sleep well and you wake up the following day, you're rested, it's not only going to help your reduction of your pain, you're going to be less grumpy with the rest of the family. The family is going to look at you in a happy way. You look at them in a happy way. So you can teach those methodology to your family, to your friends, and so it's we're basically empowering you with tools to give it to yourself, to your family and friends. So take advantage of it because this is something you can pass on, and it's very easy to implement. It just needs that consistency and making it a habit.
Absolutely. And the one thing that I like to point out here is that the whole aspect of this habit of either minimizing screen time and setting up consistency and or both, they literally cost you $0 out of your pocket. And this is something that you can implement at any point. And really, there is science backed behind it to show that it does work. It just takes effort on your part, and you're worth that effort. So, for something that costs you nothing, this is something that will give you, a high yield on return for sure. So again, that saying every hour before sleep or before midnight is worth 2 hours after midnight. Again, focusing on that healing aspect. So, what we talked about several weeks ago is 30 to 60 minutes before bed, pick up an actual book and read. And if you don't wish to do that, have a warm bath. And especially if you are noticing joint or muscle discomfort, adding in 2 cups of Epsom salts into that bath water would be incredibly helpful. Meditating using something called Insight Timer, which is a free app that offers phenomenal meditations. Yeah, I can't say I love this app so much. But these are some things that you can incorporate into the routine to really optimize your sleep. Which leads us to the next topic that we had talked about, which is essentially meditation. So the saying of, the soul always knows what it needs to do to heal itself, but the challenge is to ultimately silence the mind. And so we're going to go over some topics around meditation and mindfulness. And so meditation really helps to reduce anxiety, depression, reduce high blood pressure and the risk for heart disease, improves our actual sleeping state by up to 60%, reduces chronic pain. And actually, Mark has a really interesting some words to say on this that he had said on a previous presentation that I think is worth kind of bringing up. And I think maybe, yeah, Mark, you can talk about it now if you want, because I'm just looking at the slides and I think this might be a good place to kind of talk about it.
Which one you're referring to?
About how meditation has been shown to reduce chronic pain when you compare that to some of the medications out there.
Yeah, absolutely. They did this study. This is where they kind of started with a painful stimulus and level 4 out of 10, and to see how much would it register in the brain, and registered as 4 out of 10. But because the emotion center is next to the pain center, when people got provoked and their emotion went up, that 4 signal got amplified and is scored as 6 out of 10. So they got a 50% increase in the pain stimulus because of the high emotional state. But when they repeated those same stimulus with the same subjects, but at a different time, where they allowed them how or taught them how to breathe and meditate to bring their emotion state down. And so the 4 out of 10 signal registered in the brain as 2 out of 10 signals. So reduction by 50%. And here you have that power to reduce your pain by 50% with a couple of breathing techniques and meditation. And note that every painkiller that makes it to the market, whether it's going to be approved by FDA or Health Canada, only needs to pass a threshold of 15% reduction in pain or efficacy before it gets approved in the market. So you have all those drugs that's only working at 15% at best, with all the side effects and the cost that is associated with it, versus a technique you can do for free. You can repeat it, you can't overdose from it. There's no limitation how many times you can do it, and it's going to reduce your pain by 50%. Unfortunately, most of us think about, I need the next big thing to help reduce my pain, because someone looks for a very expensive medication or very expensive device. The reality is we have a lot of tools we can tap into. We talked about the sleeping, now we can talk about the meditation, about the breathing. If you put them all together, you're going to have a great, amazing success with those. We're here to guide you, but so take advantage of all those techniques.
Yeah, and I love, I don't think it, like, it never ceases to amaze me that sort of, that in order for those pain medications to be approved, they only need to improve somebody's pain by a minimum 15%. Whereas we know that with mindfulness and meditation, minimum 50% reduction. So I think if anything, that is the calling card that people need to be experimenting and playing around with meditation and making it a part of their daily routine, for sure.
Yeah, the key thing, I believe, it's the I call it the shift. And unless you decide that you want to make a shift in your life and you want to take ownership and control your pain, and then you could do whatever it takes to learn a new habit, right? Most what I've seen, and I hate to call out on a lot of patients, is I just want a pill. I don't want to do the effort. I just want to get the results. And you think about it, even if we're not going to talk about chronic pain, people say, hey, I want to lose weight, but I got to continue to eat whatever I want.
Right.
I don't want to go to the gym. I don't want to walk. I don't want to sleep well. Just give me a pill and I'll just magically will disappear. Unfortunately, unless you put some effort, this is the universal law. You put some effort, you gotta get the results. And there's no easy way in life and with anything we do. But however, once it becomes a habit, it becomes very easy, because that's a routine. You don't think about it anymore.
Yeah, absolutely. And speaking of which, on the next slide, we talk about the different types of meditation. I definitely have played around with all of these different types in the last 5 years. And I would say specifically since September of 2021, every day I've been using the Insight Timer app to incorporate anywhere from 10 minutes to maybe a half an hour of meditation every morning. And what I have noticed is I wear like wearable technology to track my heart rate, and my resting heart rate has actually gone down. And I noticed that improvement after only 30 days of doing meditation. And that stayed pretty steady for since I've been doing it now a little bit over, I think, 6 months. So different types of meditation are for different types of people. When I was in my early mid 20s, yoga was something that I did for 5 years, and that was incredibly meditative for me. Now I'm in a place where, from sitting down and listening to guided meditations and or telling myself mantras have been incredibly helpful and healing. And so the order of how this is listed is sort of the ones that require the least amount of physical movement. So obviously with meditation, in terms of the mantras or the guided meditation or prayer, typically or even mindfulness, there's not a ton of movement involved. Qigong, Tai Chi, yoga, even a walking meditation, if that is accessible to you mobility wise, it's definitely, it's not considered, your standard sit there, close your eyes, and everything will, you're suddenly your mind goes silent. All of these different types of meditations are there towards helping you observe your thoughts without any judgment, but bringing your focus attention back into the breath.
Yeah, I love the walking part, and the reason I do that is like 2 for 1 deal, if not 3 for 1 deal. I have some kind of conditions to it when I do those walks, and the purpose of meditation, you'd go out, or preferably early in the morning, by yourself, not walking the dog, not on your phone, not listening to music, and just go for a walk for 15-20 minutes. And so first of all, this is a positive reinforcement of that. The first thing that you did in the morning is you got out and you start being active. So second, that blood will circulate through all the areas that need some blood supply, taking all um, the toxins out of your joints or out of the body. And the third one, the meditation part, is I want to focus on all the uh, bird sounds. So that way I don't get distracted of what I'm going to have for breakfast, what am I going to do for this, what I'm going to do for that. And the last part, at the same time, I can focus on my box breathing. If I can't do the 4-4-4, I could do maybe 4 in, 4 out, because I'm walking. I might not have that stamina to do the box breathing. So technically, I did 3 things. I did my breathing, my meditation, and my walking at the same time. So it's really empowering. You don't have to do a lot of it. 10-15 minutes every day will be amazing. And if you can close that loop and do another one before you go to bed, or like at nighttime, that'll be a really, really amazing way to start your day and end your day.
Yeah, which actually goes right into the second or the following slide, which is essentially what we're asking and aiming for all of our participants is to try to incorporate anywhere from 2 to 15 minutes of meditation or any type of breathing daily. And here's a list of different ways that you can incorporate those things. And, be gentle. I know back in September when I started, the saying that Buddha said was, if you are, everybody should meditate half an hour every day. And if you're too busy to meditate, meditate for an hour. And it's essentially, sometimes we tend to believe that we're too busy, we've got too much going, so there's no time for meditation. When really, it's your body is calling and needing it even more. But you need to start somewhere if you're not used to this. So I started off for 2 minutes with just listening to the sound of bells. And I just focused on that. And it sounds silly, but it was excruciatingly painful to just really bring my mind and my focus back to the sound of the bells, because it was wandering first thing in the morning. And now, I'll do meditations for 10, 15 minutes, 30 minutes every morning. Some mornings are fantastic. I am able to focus for the majority of it. I would say even after 6+ months of doing this, there are still moments where, I'm kind of in and out of thought, but I'm showing up every morning for myself, and I'm just creating that space. And it is a practice. So be gentle and compassionate with yourself if you're not having a quote unquote good meditation. The fact that you showed up to even do it, or to focus on the breath, or to do that walking meditation, showing up really is half, like you're already winning at that point.
Yeah, it's not a homework, by the way, and there's no deadline, and there's no right or wrong. And their days are better than others. If you forgot one day, no big deal. The key thing is whatever you want to do, when you promise yourself, do what you promise. Don't overwhelm yourself. I would not encourage anyone to say, hey, because I got excited with that momentum and I'm going to do 15 minutes every day. This is going to destined to fail. So if I say I'm going to do 2 minutes every second day, and that way it's more manageable. As I do it for a couple of weeks, then I can increase it to once a day and so forth. But the idea, this is more of you're learning a skill, and it might take you a little bit longer. Not every skill that we mentioned, you might master the sleeping techniques better than the meditation technique is for someone else, it's
Correct.
the other way
Yeah.
around. So it does not matter, and it's the process. And the easiest way to think about it, if you pick up driving for the first time, it's going to take you 6 months to a year to become really safe driver, not even good driver, just safe driver. Same thing with here. If you pick up all those techniques within 6 months to a year, you have a lot around your belt, all those tools and techniques. The idea is to empower you with all of those, to know when to bring what in what situation. So you cannot overwhelm yourself and try to learn a 1 year process within a couple of weeks. So don't do that. Just focus on a couple of different elements and start that journey.
Absolutely. And now, a few weeks ago, we were talking about sort of how our self-worth, how our perception towards things can really impact our health and our ability to heal. And the saying here that your body and its trillion of cells hears everything your brain says. And I can tell you personal experience. I used to do a lot of indoor and sometimes some outdoor climbing. And anytime I would go up on the wall, and if I was in a very highly judgmental headspace, so for example, if I just saw somebody else climb the exact same wall, and I said to myself, they did a really great job, I'm not as strong of a performer, I don't really climb as well. And anytime I would go in with that type of mental construct and go climb that wall, for sure, it would be a horrible climb. I'd fall, it would just not be a fun time. But if I were to go onto the wall and sort of just focus on what I'm capable of achieving and just going there to have fun and just showing up, man, was I killing the climbs and just doing awesome. And so, what we tell and think, what goes on in our brain plays out in our body. And so it's really important to remember that. Because again, on the next slide, our thoughts can trigger chemical messengers in our brain, and then our cells take action. And so, actually, I think, Mark, you had a really good sort of way of summarizing how this actually impacts people with regards to the injections that you do with them.
Yeah, there's a couple of different messages that I have. Is just the one I think about it. Are you referring to the we talked
The
about?
growth hormone.
Yeah, so the growth hormone, if you think about it, the cortisol level will pick up in the morning just to wake up all the organs. So basically, hey, it's going to increase the resting heart rate, it's going to increase the breathing, the kidney flow to help with the detoxification and so forth. So once all those organs are up and running, and the easiest analogy I think about it is if you have a coffee shop and the doors open at 6, the employees got to show up at 5 to prep the coffee, open up the lights, uh, uh, open the doors, turn the lights on, do all the prep work that needed before they open the door at 6 o'clock. So the cortisol is exactly doing that purpose. But once everything is up and running, the cortisol levels start going down. And by around 4 or 5 o'clock, the cortisol level is down. That's when the growth hormone starts to climb slowly. And it peaks between 10 p.m. all the way till 5 a.m. That's when the cortisol rises up again. So the growth hormone is responsible for healing and repairing, building, for weight loss, muscle gain, recovery. All of that happens, and there's a contingency to it that there should be no food, because once you have food, insulin will go up and the growth hormone will go down. That's why we don't want you to lose on that window. If you don't sleep, there's no growth hormone. If you eat before you go to bed, there's no growth hormone. If you stress out all the time, cortisol level will be always up, and the growth hormone will not come up. So you live in that state where the growth hormone is capable, it wants to heal you, but we're not giving it the opportunity for it to shine in the right environment, and that's why it stays all the way in the background.
Yeah. And also as well, again, the fact that the way how we think, our brains can be our prison, and our brains and our minds can also be like the most ultimate place of freedom. And it's just a matter of um, how we choose to go through life and make the choices, which one do you want to live in? Because ultimately, it does have an impact on those chemical messengers and those hormones that take place in your body.
Absolutely, absolutely.
So this is a really great sort of image to show the ways how stress and those different negative mindsets can really impact your overall health. And so we can see here the big ones that I want to point out is your gut. If you are in a constant chronic state of stress, you're going to have difficulties absorbing new nutrition, diarrhea, constipation, bloating, pain, discomfort. Your reproductive system. People will oftentimes show up in my clinic and they'll say, I have no libido. Can I get a pill for my libido? And it's just like, it doesn't work that way. That's usually an indication that there's something bigger going on. And oftentimes the root cause is stress. Increase in PMS symptoms, decreased immune system. And obviously, for people who are here today, what they're probably most interested in hearing about is how increased chronic stress in general can increase inflammation, tension, aches, pains, muscle tightness. And we are not saying that you are in this current state of your health crisis because you put yourself there because you poorly manage stress. What we are saying is that stress has a major impact on that. And again, it's the low hanging fruit. If we can help you to learn ways how to best manage your stress, your body inherently knows what it needs to do to repair itself. And so we're just planting those seeds to help teach you how to best manage your stress in general. So going back into the fight or flight response, if your brain is full of these stressful negative beliefs, your body is in that constant state of fight or flight. So again, more in that sympathetic nervous system. But when you allow yourself to be in a place of positive and hopeful beliefs, and when I say positive, I don't mean to say that we're going to ignore that you have chronic pain. We're going to ignore the current life situations because that's toxic positivity. But what we are saying is that, okay, I am having chronic pain, but my body knows what it needs to do to heal me. And that's a different way of framing things. And we know that when you are able to reframe things and be more resilient, you can be more in that parasympathetic nervous system, which is by far more healing for the overall body.
Yeah, so just to add another point here is just how you ask yourself the question or the statement. Always when you ask a better question or you put a better statement, it can give you the same outcome. Back to the same general analogy that everybody knows, when you look at a cup that's half full versus half empty, it's the same outcome. It just depends on how you want to look at it. And that's exactly what we're talking about. You got to look at rather than focusing on the pain, focus on all the other amazing things that you have in your life. Yeah, the pain is going to be one part of it. Let's have a positive impact where I say, what can I do today? How can I do this today? Rather than I can't do that today, right? So it's just
Absolutely.
the verbiage of how you put things, it empowers you. Back to the cell, the slide where you said the brain has trillions of cells and it listens to everything I say. Well, you are the boss, and whatever you feed those cells, the body's going to listen. If you tell the body, I can't, I'm messed up, I'm screwed, and I heard patients doing that, versus what can I do today? Yes, I have a flare up today. What can I do within that confinement? Is there something I can do? Can I do the pacing technique? Can I skip something today and do it tomorrow? And again, you think about it with athletes, they don't, even if they don't have chronic pain, their endurance level or stamina is not the same every day. And they have to go and gauge it day by day. They don't say that they're a failure if they can't push a weight or can't do that run. because they were exhausted a couple of days before. They gauge their body and go accordingly. So you always look, hey, you're a champion. It's just you got to go follow what your body is telling you, but don't fall a victim on the other side where say, oh, my body told me to sleep all day. That's not what your body told you, right? And now you have to differentiate between what you're seeding or telling yourself the negative thoughts or do extreme positive. You have to be that balance, and that becomes an art. And that's where the whole training comes in. You practice and practice and practice till you be able to listen to your body and give that positive feedback.
Absolutely. And on the next slide, we're just sort of highlighting again that sort of the worrisome or illness focused beliefs can really trigger your brain into more of that sympathetic nervous system. And that's where you get the cascade of those hormones that are really working against you. So it's really sort of, reframing things and reframing how you look at your health, how you believe, what's possible for you. And also knowing that you're worthy of having the optimal health. And on the next slide, you can see that by having those feelings, you can reduce those stress-related hormones, you can increase your immune function, and you can really help to promote speedy recovery. Like I remember actually when I was in, I think it was in naturopathic college, reading a study that they had children at Sick Kids Hospital. They had a group. One group was basically assigned to, and both groups had cancer. One group was assigned to play a video game, and the video game was focused on saying, your mission is to essentially kill the bad guys, and the bad guys are essentially the cells that are causing your cancer. And then the other group didn't really have, they were a placebo, so they didn't really have the video game to play with. They kind of just were off to have free play. And in that study, the kids who actually were playing the video game, who believed that by them shooting off the bad guys, they were actually impacting their body's ability to kill the cancer cells, actually went into remission a whole lot faster than the other kids. And they both received the same level of treatment. And I remember when I read that study, just being completely fascinated. Like, if anything, that just shows you the true power of your mind that anybody has the ability to harness.
No, I totally believe in that. And I've seen it in and out, like with a lot of patients, including myself. And yeah.
Absolutely. So for your next step, something that you can consider doing is, at some point, sit down, make a list of all the things in your life that bring a sense of either peace, comfort, strength, love, connection. And from that list, you can just put it up on your kitchen fridge and sort of make it a point to engage with maybe one of those things for a minimum of 2 minutes a day and see how that can impact the way how you move through your day. See how that can change the relationships of those around you. See how that changes the relationship that you have with yourself. It really is, it's a simple exercise, but I really think it can be eye-opening for a lot of different people. And then in terms of our last couple of weeks, we've gone through about the importance of movement. And movement is a medicine for creating change in a person's physical, emotional, and mental states. So we know when you are experiencing chronic pain, what does the body typically look like? It moves inward. Our shoulders roll in. Our backs are rolled in. We typically don't move often because of the pain. And this has an impact in our ability to engage with the world around us. So we know that the movement and the lack of movement can impact both our physical, emotional, and mental states. Now, specifically with regards to arthritis, we know that movement specifically can improve our range of motion, build stronger muscles, and this is hugely important as we age because poor muscle mass has been linked to poor balance and then more likelihood of having falls, and that just leads to a whole cascade of other health concerns. But definitely movement can help with our endurance and better balance. And so, not everybody wants to be a pro athlete, But some people want to be able to play with their grandchildren out on the grass, or some people want to be able to go play pickleball with their friends when they're in retirement, or, whenever. So it's about sort of asking yourself, what is it that I can't do now that I wish to do? And focus on those little goals to help motivate you to do the movement, to help gain the benefits such as the endurance, balance, and improved range of motion.
I'd like to add another point is the whole concept of movement is evolving around muscle mass or muscle strength. And 1 pound of extra fat on our body will consume 5 calories per 24 hours. 1 extra pound of muscle will consume 50 calories per 24 hours. So for example, someone that have an extra 10 pounds of fat, the body has to maintain that fat by spending 50 calories per 24 hours. If they have 10 pounds of extra muscle, the body has to spend an extra 500 calories to maintain that muscle mass. If we don't move, the body has a lot of effort in maintaining that muscle mass. So what it does, if you don't move, the body start eating that muscle and say, well, we are not using it. There's no point of maintaining it. That's when you start losing muscle mass, and it becomes more of a vicious cycle. You get weaker and you say, I can't move because I'm weak. So you sit longer or you stay in bed, and the body says, well, okay, I have a lot of muscle that I'm feeding and maintaining that I'm not using. So let me chew up more muscle. And it's a vicious cycle. And we see that a lot in assisted living, in nursing homes, or even people that get hospitalized in the hospital for 2 to 3 weeks. Here's the ironic and sad fact that 1 pound of muscle you can lose within 2 to 3 weeks. It takes 4 to 6 months to build 1 pound of muscle.
Oh yeah.
So you can lose it within 2 to 3 weeks. You need 4 to 6 months to gain it with a proper exercise. You have it already, don't lose it. And all you need to do is just keep moving. So it's not like going to the gym, you're not lifting heavy weight, you're just basically your daily activities. So not only you preserve that mass to keep you stronger, defy aging, and because of the movement, it's going to increase that blood supply to the ligaments, the tendon, the joint. So you can wash out toxin, improve oxygenation, improve more nutrition. So overall, you're going to gain a lot. And we're not just talking about for pain. It's going to help you sleep better. It's going to help even with sex drive, help reduce the cortisol level, help pick up the growth hormone. There's a lot of gamut of movement. So again, it sounds silly. All of this stuff, what we've been discussing, are simple techniques available for you 24/7. It's just you need to harness those and really believe in them so to empower you.
Yeah, and so on the next slide, we've given you some options to really help improve and reduce the pain that you might be feeling. And so Qigong, Tai Chi, these are fantastic modalities. They're really grounded in Chinese medicine or Asian medicine. Slow moving really helps to balance with regards to, it improves balance and endurance specifically. Restorative yoga, walking, if walking is accessible to you and you feel like, you're not physically challenged with that, sometimes I tell patients, put a backpack on and put some cans of soup in the backpack and go for your walk then. And it's a great way to sort of like amp up the walking that you might be doing. Yin yoga, I absolutely adore this form of yoga. This is where you're essentially holding a yoga pose for roughly 3 minutes. And this is something that really has been shown in science, in a few scientific studies anyways, to help build bone mass. Yin yoga is also accessible to just about any particular body because the majority of poses, you're on your back. So it's a very restorative type of yoga, but really there to help increase lubrication to the joints. Cycling, both indoor, outdoor, and swimming. are some options. And so the goal is that we want you to try and achieve any one of those for 30 minutes, 5 times a week. So, everybody has to start somewhere. And so we typically ask people just to take note of how much movement you're getting on a daily basis. If you've got a smartphone or you wear like an iWatch or technology that sort of monitors your steps and your movement, take note of that and just try and increase it 5 to 10% on a week to week basis. And just like what Mark had said previously, some weeks are going to be amazing and you're going to hit all of the goals. You're going to be able to do the meditation, the walking, the movement, the sleeping. And then there's going to be a couple of days, maybe a full week, where you're just off and you're not in the same place where you were. And so it's important not to throw everything in the bathwater out at that point, but to sort of really just call it what it is. You fell off the bandwagon, and actually that will be our next talk in a few weeks. But essentially, slowly get back to building yourself back up again. And movement really is a celebration of what your body can do. And it's interesting because recently I took up swimming. So I probably go swimming about once a week. And every time I do a lap, I always think to myself, this is movement that my grandmother is unable to do because her arthritis has been so restrictive for her for years. And she didn't have access to the level of care that you're getting now. And I always think to myself, like, I don't want to be in that position that she's been in. And so I'm going to do what I can on a daily basis, on a weekly basis, and I'm going to celebrate what I am able to do. And today, in that moment, it's maybe doing 20 laps. But, I can definitely say last week, the best I could put out was about 10 laps. But it's just about showing up every day for yourself. Now, the last area here is about alignment and essentially posture. And so improving our posture allows our organs to essentially function as best as they can. So when you're in ideal positioning or posture, your diaphragm, which is a major muscle that basically hangs out under your ribs, can help move the lungs to expand and contract ideally. And as a result, our stomach becomes less compressed. And then guess what happens? You've got better digestion. When we are sitting and walking in ideal posture, there is better flow to the brain. And so I think on the following slide, Mark, if you go past this, so go past this one, because we just talked about this one, but talking about sort of head positioning and overall body positioning and how that can reduce pain.
Yeah, go ahead.
No, I was just going to say, you had mentioned this on 2 weeks ago. You really put it together about the syndrome with regards to poor posture.
Yeah, we have the upper cross syndrome and the lower cross syndrome. So basically what the upper cross syndrome is here, you're hunching forward. So your body has to take that. If you look at that picture on the right-hand side, the body's going to take all that weight and try to balance it, because it cannot balance it because it's like in front of us. So we tend to hunch forward, trying to protect and roll the shoulder forward. So it just, the fascia from the occiput, which is the base of the skull, all connected all the way to the tailbone. So we have one fascia that runs all the way in the back. That's the posterior chain. And if we mess up the top one, we're going to mess up the bottom one. That's when people can get contracted and cause them that lower cross syndrome, again, with the way they walk, the way you sit. The most common causes for all of what we do, honestly, is sitting. And the other one is all the electronics that we play with. So we're not designed to sit. We're not designed to be next to a screen all day long. This is the new, I guess, the 21st century. We're becoming a new species right now, where we sit most of them when we walk. And yeah, so when you do this with those positioning, it compromises with the blood flow. It overstretches the tendon, causes tendinitis, weakens the ligament, overstretch the ligament. It's just a vicious cycle. And it's gonna feel awkward to go back to a normal position. I can't believe uh, when I say that to my kids. They're all hunched, age 16, 14, and 12. And most of it happened right after COVID because
Interesting.
yeah, they were sitting 7, 8 hours for school, and then they take maybe a break for an hour or two. Now that they need to do their homework, it's a lot of sitting too. And then they, after they done, they didn't see any friends, so they play video games. So they were sitting on their chairs 7, 8, no, not 7, maybe 10, 12 hours a day. And they did that for almost 2 years. And what do they do after? They go to sleep.
Right.
My middle son, who's 14 right now, used to walk 17 to 20,000 steps before COVID. And now, when COVID hit, he was his daily activity with his Fitbit was less than 1,200 a day.
Wow.
Yeah, and that's why we need the posture. And you can't do a good posture while you're sitting. So it's kind of linked to what we talked about before. In order to have a good alignment, you have to start moving. While you move, it means that you got to stand and move, walk outside. So they kind of tie together. And it's basically you're going to be uncomfortable getting to a good posture because your body got used to the wrong uh, curvature or wrong. It became more comfortable now, and you look awkward when you sit upright.
Yes. Yeah.
Yeah.
Um, yeah. And so, going on again onto the next slide about sort of the benefits of having, good postures, it can also impact your mood. And so, and it can also improve your ability to be alert. So we know, and I see this all the time. If I have a patient, a brand new patient that comes into my clinic and they have their shoulders rolled forward, their back is quite rounded, their head is positioned forward, and they're almost gazing at the ground instead of looking at me eye to eye. You know, if anyone can paint a picture of what depression or chronic stress looks like, that's a common body positioning that people are in. So, it's really important that, and the question can then become, well, what came first, the mood or the body positioning?
Yeah.
And really, it's kind of a moot point. At this point, it's like fix what you can fix. And if you can help to improve your posture, then that will by default help to improve your mood.
Yeah, so one of the techniques they talk about is owning your space. So one of the studies
Mm,
they did for people that go for interviews, believe it or not, where you're scared, you kind of hunch down, you're almost like in a sitting fetal position, and so
right.
you don't own your space. So one of the techniques they did it on those participants is you sit on the chair, you widen your legs, you widen your arms, you open up your shoulder. So basically, you own all the space around you. It looks silly, but if you do that for 30 seconds, that's what they ask them to do for 30 seconds, then go for the interview.
Yeah.
And they performed way better just for 30 minutes because that gave them the blood flow, the breathing technique. And there must be some chemicals that get secreted when we do that posture. And you think about it with people in sports, when they celebrate sports, they raise their hands, they own the
Yes.
space. They don't go in a fetal position to celebrate. So
Correct.
really, we know how to snap in and out depression posture wise. Of course, there's other causes to depression, but we're talking about this is some of those techniques, just like we talked about before about the breathing techniques. This is something really quick. You align yourself, you position yourself within a minute or two, you're going to feel those endorphin, you're going to feel good about yourself.
Yep. And on the next slide, it essentially gives you a bit of a visual representation about, ideal posture versus a poor posture. And so we can see that with the poor posture, with your shoulders rolled forward, your head is over, definitely things are protruding outward like that. Your abdomen tends to protrude because your pelvis tilts in a funny way. I'm also a pelvic floor therapist, and this is something that I see a lot. And one of the reasons how that poor posture typically happens is a lot of people will lock their knees when they're standing. And when you lock your knees, you put a lot of pressure on your low back, and your pelvis tilts in a funny way. And this just leads to just really a lot of problems that can easily be fixed. So one of the common sorts of advice, and actually on the next slide, it kind of walks you through the ideal alignment, is the thing that I encourage a lot is to have everyone have a little slight bend in their knees. And this just basically allows your quads, your hamstrings, your glutes to become engaged. And these are the big muscles that we want engaged when you're standing, because it takes the load off of the smaller muscles into the spine.
Yeah, one of the easiest way, two things I say, imagine if someone is pulling you from your hair, top of your hair. And the other one is pop your chest, roll your chest out, you roll your shoulders backward, you pop your chest and widen your legs. Once you do that, there's no way you can hunch. So those three quick, one of those three, if you do one of them, it's hard for you to hunch and you're gonna get a really good alignment.
And what you were mentioning earlier on with regards to we're becoming a new species, right? Like we are just spending a, in, a really unhealthy amount of time sedentary. So for example, if you are sitting at a desk often for work or for school, making sure that your chair is definitely low enough so that your feet are touching the floor, so that your knees are somewhat in alignment with your hips, allowing that the height of the table is in alignment with your wrists. So you can see in the picture that your ears are more in alignment with your shoulders. It is so common with the advent of smartphones. The term tech neck has actually been something that I hear chiros and physio use often. And it's because we hold our phones below eye level. And so what do we do as a result? We try and bring our heads closer to it. And so we cause a lot of dysfunction in our upper neck, and in, people complain about, headaches, fatigue, that sort of thing. I do encourage people, if they can, invest in a standing desk. My husband was complaining about chronic upper back and neck pain prior to COVID, because he had been working from home. And we finally decided, you know what, we're just going to invest in a standing desk. Knock on wood, because my husband is my husband and refuses to see any healthcare providers. Just making that simple change, I have, knock on wood, and I'm knocking on wood now, yet to hear this man complain about his neck or shoulder. And that simple sort of change in his day-to-day has really made an impact. And again, it's about posture. And again, in terms of walking, I know I am guilty of this, and this is something that I'm trying to be mindful of. I typically walk with my head down, and I don't know why, but it's definitely a habit of mine. And encouraging myself to remind myself to try and look several feet ahead of me. So bringing my head, my gaze upward. It's also amazing what you can see on a walk when you're not just focusing on the actual sidewalk, but it improves your gait, it improves your balance, and it definitely helps to improve your vitality post walking as well.
Yeah, even if you're stuck with an office, you don't have the option to go with a standing desk, walk on the hour, walk for 5 minutes around. I mean,
100%.
yeah, so you can stretch a little bit, but because that's the thing, the sitting is going to cut circulation to the knees, to the back. And one of the most common cause for knee pain and back pain is sitting, because you cut all the nervous supply and the blood supply to the knee and the back. So again, simple tools, is just we have to apply them.
Yeah, and exactly what you were saying about sort of getting, if you're at a sitting desk, move, right? The best posture is your next posture. So even if you have quote unquote the most perfect posture, if you hold that static for more than half an hour, or, for an extended period of time, that is also quite problematic, because you are in effect changing the way of flow of circulation. So really, it's about that constant movement and sort of allowing your body to be in different positions, different postures um, on the regular. And so ultimately, what this really kind of brings us to is, the true VIP method here is to address on the next slide, talking about the physical stressors, the chemical stressors, and the emotional stressors. And I hope in these several weeks or these several months that we've been together, and by you listening to these different presentations, is for you to see how these different types of stressors can impact your health, and we're giving you the tools and we're planting the seed to show you, okay, this is how isolation may impact your overall health. Okay, so what is one way that we can do? What is something that we can do to improve that? This is how a sedentary lifestyle can negatively impact how your joints are healing. Great. What are some ways that we can do that? So we really are addressing the three sort of key areas that a lot of people are dealing with to really help optimize their health.
That was amazing. I know this is one of the lengthiest sessions we've ever had. Is just putting all this together, all the work that we've done in the last 3 months, 4 months.
Yeah.
It's just connecting the dots. And again, I thought personally if we could do it in a manual or a step by step. But what I've noticed in the past is when I did that, people might resonate with the walking before they resonate with the sleep, or they might resonate with the breathing techniques before they do something else, and they feel kind of disturbed, or they feel that they can't follow through because we kind of pin them through a step by step, or like a regimen. Now you're free to choose which one you want to tackle first. Literally, the whole program that we talked about, you should get a good handle on it within about 3 months or so. Just all the major four elements that we talked about: the food, the breathing, posture, the activity, sleep. Those are the five different main elements that we talk about. And just pick one, become good at it for a couple of weeks, and move to the next. And you don't have to be perfect at it. You can add to those tools in the future and revisit all of those again, and add maybe a different breathing technique, a different meditation technique, a different exercise. But at least have a baseline before you can add something else. Anything
Absolutely.
else to add, Crystal?
No, other than that, it's been definitely an honor sort of doing these presentations alongside you and helping, plant the seed for others, and, share these conversations with your loved ones, because, once they start to see you living your best life, you really are going to serve as inspiration for others to live their best lives. So, like Mark mentioned earlier on, you're not just doing this for yourself. It's really to sort of elevate the community that you're in ultimately.
Absolutely. That's something that I learned from Joel Osteen. I don't know if you've heard of him or not.
Hmm.
So he talks about you don't have to do something major or drastic to save the world. You do one habit, and he talks about a generation that's been alcoholic, and if then one of their kids decided that I'm not gonna be alcoholic, and they move away, and they continue to be sober, not touch alcohol. Now their offspring, their kids and grandkids don't touch alcohol, and look at after like 50 years or 100 years, you have hundreds of people that been saved from that kind of curse, right? And it's just one change. You don't have to be the
Yeah.
hero by reinventing the wheel. Same with you. I bet if you have chronic pain or arthritis, you have a lot of friends that you associate with as have chronic pain and arthritis. It impacts your family. It impacts you. Impacts with your kids, your grandkids, your friends. Yeah, start with the change with you and see how much other people you can become a messenger. All what we teach you here, you can teach to other people. So take that advantage to be a leader in this, and you practice what you preach.
Absolutely.
Awesome. I do thank you very much, everybody, for joining us tonight, and we'll catch up in the next couple of weeks with the next series. Take care, everybody.
Take care. Bye.
Bye.